The North Carolina Department of Health and Human Services announced changes to two state programs that help people get access to healthy food.
Yeah, that includes Food and Nutrition Services, also known as FNS, and the Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC. Well, the changes are coming because of the federal public health COVID emergency ending back in May. Fox 8's Celeste Smith joins us now live from Greensboro. Celeste, how will the changes impact those who get these benefits from this program?
I'm here at the Guilford County Health Department in Greensboro, where they have a WIC clinic, and workers say they've started bringing clients in this month to help them adjust to the changes coming next month.
I think we have a whole generation of WIC participants that have never been to the WIC clinic and that they're used to operating under those waivers. So we've been in a transition process, not to create a shock as to, how we're going to operate.
NCDHHS says more than 260,000 people in North Carolina are currently enrolled in WIC, and about 1.6 million North Carolinians currently receive FNS benefits. Federal public health emergency guidelines allow certain flexibilities and exceptions, but are now ending in the coming weeks. After August 1st, families participating in WIC will no longer be able to get product substitutions on items such as milk and yogurt in the size of some whole wheat and whole grain breads.
So that means that you have to pay close attention to what benefits you have and the exact measures and size and types of benefits.
Some of the restrictions were loosened during the pandemic due to supply chain issues. Now, Food and Nutrition Services and WIC will both have changes to their recertification process for people receiving benefits. One big change expected to impact a lot of families: WIC will no longer do extensions and automatic issuance of benefits.
That means that clients need to take action. You need to present yourself to the WIC clinic if you have a certification. Clinics are open here in Greensboro and in High Point. And if you have a nutrition education appointment, you need to complete that in order to avoid the interruption of benefits.
WIC started having clients come into the office in July to ease them into the changes, with many clients still used to the waivers.
Clients coming into the clinic are surprised as to everything that WIC offers, because it's not just giving out some benefits. So it's been a plus.
The Guilford County WIC Clinic advises families that are receiving the benefits to sign up and get the app for BNFT, which will allow them to scan items eligible for the program and also check their balances. Live in Greensboro, Celeste Smith, Fox 8 News.